127th webinar since the Andean Health Organization Hipólito Agreement started a cycle of webinars in May of. We celebrate 50 years of the Andean Health Organization of uninterrupted work of joint and coordinated actions with the Ministry of Health of the 6 countries, Bolivia, Chile, Colombia, Ecuador, Peru, and Venezuela, with a vision of advancing in guaranteeing the right to health of the population. To begin, we will give 2 key messages. First, vaccination against COVID-19 is safe and effective in protecting others. The more people we immunize, the less likely we are to become infected, as well as protecting against severe forms of the disease. Be sure to complete your vaccination schedule. There is no excuse for not vaccinating against COVID-19. Second, climate change threatens life, health, and well-being. Like any crisis, it is an opportunity for improvement. We must speak up and act to protect people and save our planet. You can contribute to generate social policies and a sustainable development model, join an initiative in defense of the environment, buy local products and plant-based foods, use public transportation, cycling, and walking, reduce consumption, reuse, repair, and recycle, restore the relationship with nature. Nature is health. It is essential to recognize the ancestral knowledge of native peoples who have lived in balance with Mother Earth, to overcome the reductionist vision of nature as a resource and to practice good living. We are the generation that can make peace with nature. Today, Thursday, June 23rd, 2022, we open our virtual doors with the objective of commemorating the International Day Against Drug Abuse and Illicit Trafficking by presenting the global and regional situation of alcohol and other drug use in the context of the pandemic, as well as national experiences in the fight against the production and consumption of these substances. We invite you to leave your name, your organization, and country from which you are joining us in this webinar through the comment box of the Facebook Live chat or YouTube Live. In the same space, you can leave your questions or send them via email to webinarhorasconju@gmail.com. In this webinar, we will follow the following dynamic. We will begin with institutional greetings, followed by the speakers' presentations, the active break, and we will end with a Q&A session. To access the certificate of attendance of this webinar, as usual, in any of the Facebook Live or YouTube chats, you will find a fixed link where you must fill out a brief survey and then leave your data for the issuance of the certificate of attendance, which will be sent in the coming days to your emails. To begin this important day, I will give the floor to Dr. Maria del Carmen Calle Davila, who is the Executive Secretary of Horas Conju and will give the institutional welcome and greeting. Go ahead, Dr. Calle. Thank you, Forley. Thank you so much. Well, the Andean Health Organization, Hipólito Agreement, Horas Conju, was established by decision of the Ministers of Health, Bolivia, Chile, Colombia, Ecuador, Peru, and Venezuela. Last December the 18th, we celebrated 50 years of uninterrupted work with the vision of making significant progress in the effective exercise of the right to health of the population. I cordially welcome you to the webinar number 127, Alcohol and Other Drug Use in the Context of the COVID-19 Pandemic, to commemorate the International Day Against Drug Abuse and Illicit Trafficking. This year's theme is addressing the challenges of drugs in health and humanitarian crisis. That is why we propose this webinar emphasis on data and initiatives corresponding to the context of COVID-19. On such sensitive issues, such as the drug use and consumption, it is important to know the real data and to share verified and evidence-based information with society, governments, and families, especially young people, in order to achieve the primary objective of preventing drug use. Increasingly, the perception of risk regarding drug use is decreasing, especially among the adolescent population, who do not consider that drug use is harmful to their health and social well-being. And this low perception of risks translates into increased consumption. According to the World Report, 275 million people consumed drugs last year, and about 15% of them suffered from drug use disorder. The pandemic has exacerbated existing inequalities and has placed populations in situations of greater vulnerability and risk of substance and alcohol use. But it has also offered us new ways to innovate and adapt prevention and treatment services, which represents an opportunity for a more comprehensive approach of this problem. Today, with speakers who are specialists in the subject, we will learn about the global and regional situation regarding the consumption of alcohol and other drugs, as well as the successful experience in one of our Andean countries in the prevention of production and consumption. Welcome, Anja Buse. Welcome, Maristela Monteiro. Welcome, William Cabanillas. Welcome to all those who join us through our social networks. After the greeting of our Executive Secretary, I will introduce myself. My name is Forli Chavez Romero, Public Health and Global Health Professional of Horas Conju, and I am pleased to be in charge of the moderation of this webinar. On this occasion, experts from the United Nations Office on Drug and Crime, the Pan American Health Organization, and the National Commission for Development of Life Without Drugs, MEDIDA, who have extensive experience in this issue and will be with us. After this preamble, we start this webinar with the presentation, World Drug Report 2021, Substance Use in the Context of Humanitarian Crisis, for which we welcome Dr. Anja Bus, who is Program Officer of the Prevention, Treatment, and Rehabilitation Section of the Drug Prevention and Health Branch of UNODC, of the Office Against Drugs and Crime. She has been involved since 2005 in the implementation of UNOC's global projects on drug dependence treatment and care in different functions. She is a psychologist graduated from the University of Berlin in Germany with a master's degree in public health from the Medical School of Hanover, Germany, and trained in family therapy. Its current duties include coordination of the UNODC WHO program on drug dependence treatment and care, where she supports the development of the UNODC WHO international standards for the treatment of drug use disorders and the manual on treatment and care of people of drug use disorders in contact with the criminal justice system. Welcome, Dr. Anja Bus. You have 20 minutes for your presentation. Thank you so much. It is a pleasure and an honor to be with you. And I think that this is the first time, believe, that UNODC here with you in the Andean Health Organization. So it's a double pleasure And also, happy birthday. I understand you're celebrating your 50th anniversary. So that's also important. Well, I'm going to talk about the use of drugs in the context of the COVID-19, but also taking into consideration the International Day of Drugs in the context of humanitarian crisis. And I will start by acknowledging Cristina and Elena that worked with me in the presentation. Something I'm going to ask you, if you could please have your cell phones, because we're going to have some interaction element in it. We'll see if it works. So just to tell you what is UNODC, the ONUT, it's a UN program created to help the member states to approach global challenge such as drugs, crime, and terrorism through technical assistance. So our executive director, Mrs. Gadavalli, responds directly to the General Secretary General of the UN, Antonio Guterres. We have presence in every country in the world and in Latin America, where we have regional and national offices. And I come from an epidemiology program, but I'm coordinating, as I mentioned, the global program for treatment of drug use disorders from UNODC. And these are the countries where we include Latin America, where we are currently working. And now we go into our topic of June 26th. It's the International Day Against Drug Abuse and Illicit Trafficking. And this year, we have as a topic, as we have talk addressing drug challenges in humanitarian and health crises. I will talk about both topics that are similar but a little bit different. This is what I'm going to talk today. And let's go directly into the topic. So the situation, the global situation with respect to drug use, these few slides that I have come from the most recent report of the World Drug Report by the UNODC generates every year. And I would like to present the data from 2022, but they're still being under embargo, and we will issue them on June 26 or 27. So if you heard Dr. Calle, you can respond to this question. If you would like to scan this QR code, and we'll just give you a few minutes to see what is the answer to that question. And you think how many people have used a drug in 2019, a substance under international control, one drug. I don't know if someone would like to respond. You need to scan the QR code and enter your question. This is the first time I do it, so I'm not sure if this is going to work or not, because I don't see any answer. Of those of you who are online, now we have 3 people online who are responding, but I don't see the answer. Okay. Most of people thought, 40% of you, as we have 275 million people, and you heard Dr. Calle answering. That is the answer from the World Report. We know that 5.5% of the world's population aged 15 to 64 years have used drugs at least once, an international control system in 2019. And this is 22% higher than in the year 2010. This has to do with the population growth worldwide, and more than 36 million people suffer from drug dependence, and they could benefit by treatment by drug use disorders. We also know that approximately 11 million people are globally using intravenous drugs, and we have lost 500,000 lives to drug use disorders in 2019. And that is also an increase compared to the 2010. So all those figures are increasing and has to do with population growth, but not also that, but this year we'll be able to see the changes by COVID-19 that started in 2010, but we have some information with us. Now thinking in these 36 million people with drug use disorders, what we always mention is the global scandal that only 1 in 8 people have access to treatment with substance use disorders, and 7 out of 8 have no access whatsoever to any type of treatment. And the situation is even worse in women, who are 1 in 3 who are using drugs, but only 1 in 6 are receiving treatment. So women somehow are left along the way. So this is what the World Report tells us about the demand for treatment and changes in years in Latin America and the Caribbean. In the red circle, we can see that presently cannabis is a system that's more the reason why people search for treatment, followed by cocaine. And there's been a change in time as we see that the treatment for the use of opioids is also increasing. And some data that come from this World Report of 2021 regarding to the use of drugs during COVID-19. We all know this is data from WHO that we have more than 6 million deaths, and it's a number that I cannot pronounce in Spanish as confirmed cases of COVID-19, but there are also good news.
Más que 11, casi que son millones, ¿no? No, mucho más.
Many millions, much more of vaccine doses. I can't read numbers in Spanish that quick. So that is the situation regarding the perceived increase in the use of substances. This is data that we have from the World Drug Report as at the beginning of the pandemic. And there was the perception of professionals who work in addiction service. The perception was that there was an increase of use alcohol, cannabis, and sedatives, and pharmaceutical opioids. These are medicine too. And that somehow implied that people change to more available substances during the time of lockdowns or confinement and curfew. And in your region, in Latin America, CICAT also sent a questionnaire to member countries, and there was also the expert perception that more than 70% assume that the pandemic will increase substance use. Only half of the countries had data at that moment to support that perception. And also challenge was the perception that there could be an increase in the number of people with withdrawal syndrome with no care. This is data that we have in the WDR that come from Brazil, closer to the region, and there was an increase in the use of benzodiazepines, opiates, pharmaceuticals, and a decrease in drugs that are used in more recreational contexts such as MDMA. We have in March of 2021, a report to CND, and the summary was similar to the studies that we've seen before, with an increased use of cannabis, benzodiazepines, and pharmaceutical opioids. and a decrease in the use of opiates, amphetamines, and cocaine, at least in one phase of the pandemic, because now we continue with pandemic, and this was the perception at the beginning of the pandemic, and a reduced frequency in the use of recreational drugs. There was an increase in drug-related mortality among regular drug users. So they were consuming more, and there was an increase or shift towards injection drug use and overdoses with risks. Now, something that has not been the approach of the World Report that has to do with risk factors associated to drug consumption is that poverty and extreme poverty increased during COVID-19 in Latin America, and the socioeconomic inequality are creating risk conditions for people who are going to start or are already using drugs and don't have access to services. So I would like to miss the opportunity to speak a little bit about the response, because at the beginning of the pandemic, in March of 2020, we launched together with WHO international standards for the treatment of mental health care disorders, the drug use and adaptation of treatment services during the COVID-19. Here, if you want, we can try again. You can scan the QR code and let me know if you have heard about the international standards for the treatment of drug use disorders, if you have read it, or you know the content, or you haven't heard it yet of those international standards. Two people have responded that, okay, one person has read it. So okay, at least this is working. We have 4 people online. Some have even read it. That's perfect. Thank you so much. Okay, if we wait, I really like this, to be in contact with you. So most of you have not heard about it, but some of you have heard about it or have read it. So the international standards, this is a summary of the evidence for the treatment of drug use disorders that are based in evidence and are to support the member states in the development expansion of services for the treatment of drug use disorders, and is describing a continuum of care in different environments, and is based in large part on existing in WHO and UNODC, and have a political acknowledgement in the General Assembly and the UNGASS and CND recognize. This is the content. Those of you who haven't read it, I invite you. They talk about the treatment in the different contexts and evidence-based interventions. Due to reasons, due to time limitations, we cannot go into more depth, but there is this document and there is translated to Spanish in our webpage. And these are some of the evidence-based psychosocial interventions that are described in more detail in the standards, and also pharmacological interventions, like we know, for example, the treatment, maintenance treatment with opioid agonists such as methadone, buprenorphine, and others, which are included in the document. At the system level, we are talking about public health principle to identify the most effective, less invasive, and least costly intervention in this pyramid model. So the standards in summary are a continuum of evidence-based care in different contexts and a perception of a system. For, as we said before, the question, how can we adapt this to the continuum care during the pandemic? So, due to technical reasons, I cannot read my question, but can you do a scan of the QR? And the question is, what are the biggest challenges to face in your country with respect to COVID-19 and the treatment of drug-induced disorders? Just mention one word, some experience, just one word. There's nobody responding at this moment. Stigma, availability, quarantine, lockdown. Those are things that we've seen before. So the low access to services. Thank you for those who have participated. Something that we know, this was a risk study that COVID-19 affects people with substance use disorders in terms of increased risk of morbidity and mortality by COVID-19. And this is for those consuming opioids, and opioids have an effect on the respiratory system, and COVID-19 also, of course, and because of the high prevalence of medical comorbidities in people who have drug use disorders, so need to pay attention, and they need a special care. So, like in the beginning of the pandemic, we launched the international standards to drug use disorders. With other agencies, we launched suggestions regarding treatment of drug use disorders in the context of COVID-19. As you mentioned, how these lockdowns were like a challenge. So the recommendation was regards to continuous access to treatment services, guarantee the safety of the staff and the patients, and standards for cleanliness and hygiene, and also the recommendations about the access to vaccines. So under treatment during the pandemic, what we have seen, how the member states told us an increase in the seeking treatment and less access to drugs, so people felt like a withdrawal symptom, and that was a motivation to search, to seek for treatment. And there was also a problem with drug availability due to logistic problems during the COVID-19, especially for the pharmacological treatment. And these socioeconomic impacts of confinements and curfews affected the livelihoods of people who use drugs. Well, this is data from our colleagues from WHO that mental health services saw an interactions of many types of critical mental health critical services such as psychosocial, but also as pharmacological treatment. I'm going a little faster because of time. This was also this perception or information from professionals from ISAM. They indicated that the adaptation of treatment services, that medical and psychiatric care continued, but there was a partial reduction in services who were working on the streets, or sometimes the access to medications such as methadone or buprenorphine. 40% reported that, and there was no sufficient measures to prevent overdose during part of the pandemic. These are examples that we see in the World Drug Report that in Colombia, the perception that people had difficulty accessing medications. In Peru, we were told that some of the treatment services continue to operate remotely. And in Colombia, it was reported that difficulty to contact these services with low threshold. So how the services adapted, in summary, we can say that there was innovation, for example, with drug prescription for longer periods of time, or online services, telemedicine, but we need to be careful because we still need to evaluate this. And this publication from WHO that was issued before the pandemic warned us that not everyone has access to internet. So this is not the answer to all the problems that occurred during the pandemic, and that digital health intervention do not substitute health functioning of health systems. So for UNODC, we've seen how countries throughout the world have donated commodities and personal protection products. We've worked with countries and people that were previously trained, for example, tele-advisory or telemedicine services. An example in Nigeria, Latin American also, we've worked a lot with this webinar format and virtual consultations with implementing entire virtual projects of quality assurance of treatment services. And now we have launched a basic course, counseling course in our e-learning platform. And these are things that were issued during the pandemic. Well, this is like the last portion. I'm going to use 3 more minutes. I don't know how I am in time. Drug use and treatment of drug use disorders in humanitarian crisis. And now the United Nations systems have with OCHA, with 3 emergent global emergencies that need an activation of the humanitarian service at this moment in Afghanistan, the northern Ethiopia, and Ukraine. And then we at UNODC are participating in these coordinating efforts. And we have a report from UNHCR that there are more people or displaced, forced displacement than before. So these are 90 million people globally. So there are different contexts of humanitarian situations, and the response also depends if we are in urban situations, if these are inaccessible situations, and this is a rapid onset or acute phase with a slow start. So, so the question is the use of substance. What does that have to do with this? And here we are looking at the risk factors and the enhanced protective factors such as war, conflicts, poverty, refugee status. These all are maybe risk factors, or have an effect in terms of mental health or traumatic experiences. So we need to think in these in humanitarian situations. The truth is that we have very little evidence about the epidemiology in the use of substance in those situations such as displacement or conflicts or war. But what we do know that the prevalence is many times similar or lower with regards to the host community. But we need to understand that better. So the response in humanitarian situations works what we call cluster in sectors, and the health sector is through the WHO is one of the key sectors And here we can coordinate topics just as the use of substances. And these are some of the humanitarian principles that we need to take into consideration to provide an answer, in, including, as you said, as a response in humanitarians. And these are the agencies that usually intervene, such as the UN, the Red Cross, or the Red Crescent movement, but also many civil society organizations, and of course, governments. So we are thinking on this, and we are in the process of developing a new publication of how can we adapt and apply the international standards to different situations of humanitarian crisis. And we mentioned that there's little information on the use of substances, but there's also little information about the availability, accessibility of treatment and support services at the level of the system that we saw at the beginning. These are situations that have a high prevalence in the use of drugs before the current conflict or the current situation. So what we can do and what we have done in rapid evaluations, such as displacements, and now with a group of experts and some coordination with agencies such as WHO and UNHCR, we are analyzing a publication. I need to finish. So what we are doing is we are in the process of adapting this prioritization pyramid in humanitarian context to the pyramid of the use of treatment services. And hopefully this year we're going to issue this publication. We're going to do a pilot test in the Andean region in the border between Colombia and Ecuador, and the rapid evaluation is already course. And this is the summary of the document that's going to be issued. But due to time, this is the key message from my presentation, that we need our intervention for drug use disorders or substance use disorders that should be considered as essential components of general health services in humanitarian and health crisis environments, so we don't leave nobody behind. Just so we don't forget that the International Day Against Drug Abuse and Illicit Trafficking in June 26th. Thank you so much for your attention and your time. Thank you. We thank Dr. Booth's presentation shows both the current world situation of drug consumption and drug use disorders. She mentioned that between 2010 and 2019, drug consumption increased 22%, which represents a public health problem. And alarming information is the big gap between treatment access, where 1 out of 8 people with drug use disorder have access to treatment, where women have a lower access. You mentioned drug consumption during the first stages of COVID-19 pandemic, where the use of substances such as alcohol, cannabis, sedatives, and opioids increased. Among the causes were the situation of vulnerability and poverty to which people were exposed due to the socioeconomic crisis. We share the international standard for the treatment of drug use disorders, who provide prevention and treatment strategies that are based in evidence, and the importance of the concept of continuum of care, especially in the context of the pandemic, where people with drug use disorders have a greater risk of morbidity and mortality due to COVID-19. With regards to the treatment and access, to show how care systems and the availability of drugs for drug use disorders were affected during the pandemic. But at the same time, this meant an opportunity to accelerate digital innovations and provide continuum to care but it should consider that don't replace the current on-site care. She shares some of the courses and the reflection that together with COVID-19, there are other scenarios of humanitarian crisis throughout the world where interventions for the drug use disorders are essential, considering the use of international standards and identify the most effective intervention, the less effective and low cost to reach the greater number of people. Dear Dr. Anja, once again, thank you so much for your presentation, and we invite you to stay in the room for the Q&A session. We continue with the webinar to talk about alcohol consumption, and we would like to welcome Dr. Maristela Monteiro, who is a physician with a PhD in psychopharmacology from the Federal University of Sao Paulo, Brazil. She has done postdoctoral studies in clinical psychiatry at the University of California in San Diego in the US. Dr. Monteiro has been a senior advisor for alcohol of the Pan American Health Organization and the World Health Organization for 25 years. She is responsible for activities related to public health policies, for control of alcoholic beverages, research, training of health professionals, and implementation of the regional plan for the reduction of harmful use of alcohol. Dr. Monteiro is the author of more than 190 papers in scientific journals and technical book chapters. She is the author of 6 books and more than 45 scientific articles on this subject. Welcome, dear Dr. Maristela Monteiro. You have 20 minutes for your presentation. The space is yours. Thank you. I'd like to share my screen.
Por favor, no se olvide de activar el audio.
Don't forget to activate your audio. Thank you to all of you for participating and for inviting me to this webinar. I'm going to talk about the impact of alcohol during the pandemic, how we are today, and what has PAHO done to fight the problems that have emerged or increased during this pandemic. For that, it is important to know that before the pandemic, the consumption of alcohol in the Americas was extremely high, the second highest in the world, and the world's lowest level of abstention compared to other regions of WHO, and approximately 25% of the general adult population or over the age of 15 reported an excessive drink consumption. And in women, we have the highest prevalence in the world of alcohol use disorders, a dependence on, according to the diagnostic criteria. These are data of great concern before the pandemic. And up to the year 2019, there was 379,000 deaths every year, which represent 5.5% of death by all causes in the region, and many tallies lost, almost 19 million tallies, with an early mortality or due to disability due to alcohol consumption. Alcohol is also linked to the leading causes of death in the younger population between 15 and 49 years of age. in the Americas. From the 8 leading causes of death, 7 are related to alcohol consumption, including some related to violence, suicide, and use of other. And this situation reflects the lack of commitment and action by the governments to have a public health response to the consequences of alcohol consumption. We see that up to 2016, most of the countries did not have, and it's still the same, a national policy adopted or implemented with the issue of alcohol. And in 2020, we did an analysis of the existing policies, the existing laws and programs in each country, according to the World Strategy to Reduce Alcohol Consumption. The strategy was adopted in 2010 and has 10 areas. The political, and we've used with a scale that was validated and used in Europe and was adapted for the Americas. And we did the same evaluation in each country of how much they had adapted these political areas of the strategy. And here we have a summary of the average from each country. But in the report, we have country by country. And you see the highest score in each area is of 100. And this is the average that we saw that was quite low. And the most important measures, which are number 5, 6, and 7, about the availability of alcohol marketing and pricing policies or taxes, are the lowest that have been less implemented in our region. So when there is no effective policy or laws in these areas, consumption will not decrease. The consequences are also expected to be worse. We also carry out an analysis of the alcohol consumption evolution in the region since 1990, 2016. And the conclusion was that the average didn't change.
Una baja, una reducción, si uno usa de
At all during this period.
hasta 2016
From
como
2010 to 2016,
de reducción, lo que es muy
with a
bajo
reduction,
para
which is very low,
menos del esperado,
less than the one expected
dimensión del problema que tenemos.
for the dimension of the problem we have. What happened with the pandemic? They stayed at home, the business were closed, a lot of restriction in many countries, not all of them, but some of them banned the sale of alcohol at the beginning of the pandemic. But the most remarkable was the misinformation of fake news and lies that spread through the internet and social media. For example, that alcohol is going to destroy the virus, drinking strong beverages, you won't get infected, or not only to use in the skin, but also the inhalation will protect, and those who are alcohol dependent will not be infected. that alcohol may stimulate immunity and resistance to viruses. And there were many support messages of normalizing consumption will be understandable, acceptable, that there's so many problems, so let's drink alcohol to deal with these issues, with the stress situation, with depression, and that led to significant changes that we're going to see here. So misinformation and the lack of understanding of the alcohol issue, which already existed, but it did expanded significantly, that led to hundreds and thousands of deaths of contaminated alcohol, and led us to think in the need to improve education on people with reliable information. So we started working with fact sheets of alcohol and COVID. We did 2 editorials in scientific journals, more than 20 webinars in several languages, and we also carry out a regional alcohol survey with more than 20,000 participants about the alcohol consumption. And this survey was in 2020. So that was at the beginning of the pandemic, and what we saw that there was a reduction in the use, but people who already consume it and use excessive alcohol did increase even more their consumption. This is an important finding, that people who drink little less reduce their consumption, that people that drank more drank even more during the pandemic. And we were asking questions online about violence and alcohol consumption, and we saw an increase in violence against women reports and children also during the pandemic. And many people indicated that for the police or social services, they saw the role of alcohol. I apologize for this. Slides are in English. Just to mention other substances that the previous speaker has already mentioned. But for other substances, the risk of acquiring COVID-19 increased with their use. There was also increase the online games, and also the disruption of services was significant and prolonged in many countries. And for alcohol, there was a specialized services efficiency, and people couldn't access, ask, and receive some type of counseling. And other surveys from the global surveys evident the factors that were linked to the use of alcohol. Of course, related to mental health issues, that not necessarily as a disease, but the sensation of anxiety, panic, stress, lack of hope, uncertainty, what's going to happen with this pandemic. So people started using alcohol in order to deal with the situation. Those who had mental health problems this only got
El
worse.
alcohol afecta el sueño,
Alcohol affects
afecta,
sleep,
también puede incrementar la
may also
ansiedad,
increase
incrementa el
aggressiveness,
estrés también.
and
Y la idea, la gente
the
tiene que
idea
sí,
that
que
people
voy a
have
tomar el alcohol
is that
para
I'm going to
calmarme,
drink alcohol
pero
to
son
calm myself,
pequeñas dosis,
but
mucho bajas, es que tiene ese
only
efecto y
through
puede
very low doses of alcohol you see that effect.
incrementar
Then it
la
increases
ansiedad con el uso
the
de alcohol.
anxiety with the use of
Solo
more
contribuye
alcohol.
para
So
peorar
this
los
only
problemas.
contributes to make people problems
Y
even worse.
sería, es
And
muy importante
it is
que
very
apoye, promover de una
important
manera integral
to
no solo
promote
situaciones
in a
urgentes, problemas
comprehensive
mentales y
manner
drogas,
to
fue la
the
promoción de una mejor respuesta
promotion of a
en
better
situaciones de
response
emergencia de
in
todo tipo,
public health emergencies,
pero
not only during the pandemic,
un terremoto,
but also
o un apagón
earthquake
sísmico o
or
crisis que siempre tenemos en nuestra
crisis that
región.
we all have in
Y
our
es
region,
necesario tener
that
una
we need to
promoción
have
de
a
educación
promotion of
sobre cómo la salud
education
mental
on
afecta la
how
salud
mental health
física y al
affects physical
contrario,
health
la eliminación del
and
estigma,
the
que se
elimination
tiene
of
que hablar sobre sus
stigmatization.
problemas,
People need to
sobre
talk
su
about their
situación. No
problems,
tiene
their
que estar
situation.
siempre en sonrisa y feliz todo el tiempo. Es
They don't
ilusión.
need to be
Y
happy and
es muy
smiling all the
importante
time. This is a
estar,
myth. And
si
it's
se
very
sentir
important
a voluntad o
to
libre para
express
hablar
your
de
will
problemas
and
que no solo son
be able to
su
speak
hipertensión o
of
el
problems that are
diabetes,
not
pero
just
también
hypertension or
problemas de
diabetes, but
lidiar con
also
situaciones
the
que
issues of
tenemos en
dealing
el
with
día a
the
día.
situations that we have.
Con relación al alcohol,
With
entonces,
relation alcohol use,
hubieron factores
there
para
were
llevar a un aumento
factors
del
to
consumo,
increase
pero
consumption,
también
but
para
there were also
disminuir el
factors
consumo.
to
Y
lower
depende del
consumption,
país y de la
depending
situación
on
de
the
pandemia
country
y
and the
las
pandemic situation
soluciones que se fueron
and the
adoptadas,
solutions that were
cada
used
país o cada
in each
comunidad va a
country or
tener una respuesta
community,
distinta. No
the
uno igual
response will be
para
different.
todos.
There's no single
Pero
pattern for everyone.
para menor consumo,
But
obviamente
for
cuando
a
se
lower
disminuyó
consumption,
la venta de alcohol
when alcohol sale was
totalmente y se
done
restringió,
completely
la
that
decisión
restricted
de la
consumption,
movilidad, el cierre de
decision of
restaurantes, la falta
mobility, the
de esos
closure of
lugares
restaurants,
deportivos donde
the lack
siempre el
of
alcohol
sport events or cultural
estaba
events where
presente,
alcohol was
eso
always present,
disminuyó el consumo
that
para la
decreased
gente que
consumption
utilizaba
for
ese
people that
evento
use that type of
para
event
consumir.
to consume
Pero por
alcohol.
otro lado, dentro
But
de
on
la
the other
casa,
hand,
lidiando con
inside the house,
trabajo,
linked
familia,
to work,
situaciones conflictivas,
family, conflictive relationships,
aislamiento, cuidando de
isolation,
otros familiares,
caring for other
todo
members of
esto
the family, all
facilitó
of these facilitated
el uso de
the
alcohol.
use
Todos
of alcohol.
se moviendo a la internet, a las redes sociales,
Everybody
la promoción
using
de alcohol
internet and social media, well,
expandió
alcohol promotion
exponencialmente y
expanded
especialmente los
exponentially,
jóvenes que son
especially
muy
for the
vulnerables a
young
propaganda y
population who are
promoción
vulnerable to
de
advertisement and
malas
alcohol promotion.
sustancias.
They were more
Y
exposed.
finalmente la
Finally,
venta en línea y para entrega en
online sale
casa o
and
domicilio
delivery
de
at
todo
home
tipo de bebida alcohólica en
of every
enorme
type of alcohol
cantidad
beverages
facilitó el aumento
that
de
also
precios
facilitated.
y la compra de alcohol y no se sabe, uno
And
no confería la
you do not,
identidad de ni uno ni paraba en la puerta, solo dejaba el
they
alcohol
didn't check
en la casa
who's buying the
y
alcohol. They just leave it on the door, and that
incremento
facilitated the
del
increase of
consumo en algunos
consumption
países y
in some
los
countries.
Estados Unidos es un gran ejemplo
The US is a
llevó a
big
incremento de
example
mortalidad
where led to an
embarazo,
increase
violencia,
of
abuso de niños, mortalidad por
mortality through
alcohol
child abuse,
crónico
violence, and chronic
y
diseases
peor cuando había infección por
that got
alcohol.
worse where there was a COVID-19
Entonces,
infection.
la UPS
So
empezó en
The Pan American
por
Health Organization,
desinformación por la
due
primera
to
vez,
the misinformation present, we
lanzó una
developed
campaña de
a
concientización
campaign of
sobre los
awareness
efectos del alcohol
about the
y
effects of alcohol.
quiero mostrar
And I
ahora
would like to
uno de estos
show you
productos
some
que
of these
disponibles
products. They are all available in English, Spanish, and Portuguese in the website of the Pan American Health Organization. This is a campaign, Live Better, Drink Less.
Empecé con el video, el video está en inglés, pero
The
tenemos
video is in English. We have translated
hicimos
in Spanish too.
carteles que están
We did
disponibles,
several
también,
posters are available,
videos para
and
redes sociales
small
que también
video for
para
social
Instagram,
media,
para
for
Facebook,
Instagram, for
que
Facebook,
fueron
Twitter,
lanzados de
that
semana
were
a semana.
launched.
Aquí solo por una cuestión de tiempo,
Just
no voy a
because of
mostrar todos
time
aquí
limitation, I'm not going to show all of them
sobre el alcohol y la propaganda.
about alcohol advertisement.
Aquí, debe empezar aquí con los adolescentes.
For adolescents.
Hicimos 13 hojas
We
informativas.
did infographics on alcohol and health. This year we continue with more. We have two new ones about alcohol labeling and then violence against women. And finally, finish my presentation. We also launched first digital specialist on health and alcohol use, who's Paola, who can speak with anyone from the computer or phone or tablet in English, Spanish, or Portuguese about the alcohol issue with a brief intervention after evaluating the risk of that person. If a person wants to consider decreasing their alcohol consumption.
Hello, Paula.
Buenos días. Bom dia.
Hola.
Oi.
Buenos días.
Good morning.
É prazer te conhecer. O que você gostaria de falar hoje?
What would you like to talk about today?
Pode causar câncer?
Can drinking alcohol cause cancer? There's a strong link between alcohol and chronic disease, particularly cancer.
How can I make sure I drink responsibly?
I'm sorry to say, but there's no such thing as responsible drinking.
¿Cómo sé si estoy bebiendo demasiado?
Puedo ayudarte a evaluar si lo que bebes puede causarte daños.
Hi, I'm Paula. I'm the Pan American Health Organization's first digital health specialist on alcohol use. I was built to provide reliable information about the impact alcohol can have on your health. I can also help you check if your drinking is putting your health at risk and guide you through a plan to cut back. Do you think you could benefit from drinking less?
I know I would. Can you please help me?
I'd love to help you. And I promise I won't judge. I'm a digital person after all. I don't know how to judge.
Acabé por
Here,
poner el video en
please.
inglés, disculpe.
The video was in English, my apologies.
Partes en español, pero existe también
But we also
video
have a
solamente
version in
español
Spanish
nuestra página.
in
Y,
our webpage.
Paola es
And Paola
autónoma, animada autónomamente,
is
conforme a
an autonomously animated.
sus movimientos de face también. Si usted está triste, ella se
If you are,
si está feliz,
if you're
también
sad, she will worry. She's happy, she will
la
smile.
persona, y es totalmente
And
anónima.
this
No hay
completely and
ninguna
totally
posibilidad de
anonymous.
saber quién está
There is no way
hablando
of
con ella.
knowing
No
who
recibe
is
estos
speaking to
datos
her.
ninguna otra compañía, y
We are the only ones who
con
receive
esto
this
pasa a
data,
ser una
and this
herramienta disponible
is
para
an
el número infinito de
available tool
personas
for an infinite number of people
24 horas por
at no
día.
cost, 24 hours.
Y estamos ampliando, Paola, para que hable
Are
francés este
increasing
año,
Paola
y
to speak
además
French
temas de alcohol
and other
basado en las
topics
respuestas que ya tuvimos de los
other than
países
alcohol,
de
based
preguntas que
on the
no
questions that we have
habíamos
received in
seleccionado
recent
para que
months.
ela responder. Para trabajar el tema de política,
To work the
continuamos
politics issue,
a promover
we are promoting the
criado por la OMS, que es el
package
acrónimo
created by
SAFE,
WH
que
with the
está
SAFER acronym
que contiene las
that has
políticas
the
más
5
efectivas y
most effective and
para
cost-effective
disminuir
policies
estos
to
daños de que hablamos, que
the
es
harm that we have
limitar
mentioned,
precios por impuestos, regular la
to
publicidad,
regulate
el acceso a la
advertisement,
detección precoz
the
del
access
consumo
to early
y
detection
medidas para el debido
and
consumo,
measures
y la regulación de la disponibilidad
and
de
regulation
bebidas
of
de
the
alcohol.
physical
Este
availability of
paquete
alcohol.
es
This
promovido con
package
todos los
is
países,
promoted
varios
with the
países han
countries, and
estudiado algunas
several
leyes
countries have
basadas
changed
en
their
el paquete
laws based
para
on this package
promover y estimular
to
más
promote
el
and
cumplimiento de
stimulate
estas
the
medidas.
implementation of
Obviamente,
these
Paola
measures.
o cualquier campaña en la educación
Obviously,
no
Paola,
es
our in
suficiente
education
para
campaign is not
cambiar
enough
normas ni
to change
comportamientos.
standards or
Tenemos una industria
behaviors.
muy
We
fuerte
have a very strong industry
detrás de
that is
toda la
behind
situación
all
de
this
desenvolvimiento, la
situation
promoción y
that we are facing
la venta
by
de un
promoting
producto
and selling the
que
product
no es beneficioso a la
that is
salud
it's not
y además
benefiting
causar
health
dependencia.
and may cause dependence.
Hay muchos recursos técnicos
There are
en
many
nuestra
technical
página,
resources, all of this in our
y
web page.
tenemos ahora
And
8
now we
cursos
have
virtuales
8 virtual
que
courses
están todos disponibles
are
en
all
español y en
available
inglés
in
también.
Spanish and
Y
English at least.
En el campus virtual de
In the
la
virtual
UPS,
campus of
libres y
WPO,
aprendizaje, y
self-learning,
basta inscribirse y
and
hacer
you
el
just have
curso.
to register and
Con esto
follow,
termino
take the course.
mi
And with this, I
intervención.
finish
Gracias.
my presentation. Thank you.
Muchas gracias, doctora Maristela, por su
Thank you,
ponencia.
Dr.
Nos
Marisela,
explicó
for
sobre
your
el consumo de
presentation.
alcohol
She
en las
spoke
Américas.
about the
Como
alcohol
países de
consumption
nuestra
in the
región, es
Americas.
la segunda
She
mayor
mentioned that
fuente
a
de
region is
consumo
the
de
second one in the
alcohol
world
y la
with
región
highest
con mayor
consumption of
prevalencia de
alcohol,
consumo de
with
alcohol en
highest
mujeres.
prevalence of alcohol
Esto
consumption
implica
in
una
women.
amenaza para la salud
This
pública, ya que
implies
el
a
consumo
public
excesivo
health
de este
challenge
alcohol
since
puede
alcohol
provocar
consumption is a
muertes
risk
por las
factor
principales
for
causas de
7 of the 8
overdose.
main
Y nos
causes of
comentó la
death.
paradoja del
She
impacto
mentioned
de
the
la
paradox of
COVID-19
the
en el
impact of
uso
COVID-19 in the
como
use of
pocas
alcohol.
personas las
In the
restricciones de
early stages,
movilidad o las
the
prohibiciones del consumo de
confinement
alcohol
and alcohol ban were factors that promoted a lower consumption. However, the messages of the use of alcohol under stress condition, or that the alcohol destroys the virus that causes COVID-19, promoted a higher use of alcohol in such a way that people who usually consume alcohol before the pandemic increased their consumption during the pandemic. This led to prioritize education actions in health with reliable information. She shared the strategies implemented by PAHO in response to this problem. For example, the promotion of mental health in emergency situations and how they develop a campaign through social media, where they focus on messages for the adolescent population, and they also highlighted the development of a digital specialist, Paola, who provided reliable information focused on prevention and reduction of the use of alcohol. Invite us to look at the resources available, and she finished her presentation, reminding me the five important topics to reduce alcohol: to restrict the alcohol availability, early diagnosis and treatment, regulation of advertisement, and the increase of selective taxation to the prices of alcohol beverages. The Dr. Maristela Montero, we thank you once again for your lecture and invite you to remain in the room. And then we will have a dialogue in response to questions from our participants. Before continuing with the next presentation, we would like to greet all those who are connected and joining us from Bolivia, Chile, Colombia, Ecuador, Peru, Venezuela, Cuba, Paraguay. We continue with the topic of national experience for the prevention in the use of alcohol and substances in the educational environment. And we would like to welcome a specialist, William Cabanillas Rojas, who is a psychologist with studies in drug dependency by the Peruvian University Cayetano Heredia and political science at the Pontificia Universidad Católica del has also studied drug policy at the Centro de Investigación y Docencia Económica, CID, in Mexico. For the last 20 years, he has worked as public servant in the National Commission for Development and Life Without Drugs, an entity attached to the presidency of the Council of Ministers. He has served as coordinator and specialist of the Peruvian Drug Observatory, managing studies and indicators associated with drug policy in Peru, as well as knowledge management tasks to promote the adoption of evidence-based policies and interventions. He has experience in coordinating studies on drug demand reduction with the application of quantitative, qualitative, and mixed methods. He also has experience in the formulation of national research agendas. Welcome, dear William Cabanilla. You have 20 minutes for your presentation. The space is yours. Thank you very much for the invitation. Good afternoon to everyone. I thank the invitation on behalf of the VIDA and the Executive President Ricardo Soberón. We will present something that I believe that will complement what we've already been exposed. The National Commission for Development and Life Without Drugs is celebrating 20 years of existence in this 2022, and always with the commitment to provide comprehensive policies of drugs to promote different processes that we are going to present now. First thing that I would like to share with you, this table that shows us the pre-pandemic data. This is 2017, as we can see. The substances of higher prevalence in the population studied in Peru was alcohol, tobacco, marijuana, and tranquilizers. This undoubtedly is an important alert because when we do the breakdown, for example, by gender, we see data that call our attention from the public health perspective for 2017, the adolescent female population was higher than the masculine adolescent population in alcohol consumption. We see the trajectory, the course. Use a pointer. We see that in 2012, previous measurement, the prevalence were very close. But for 2017, we observed a higher prevalence in the female population, and this data behavior is also observed in other categories that were included in the study: drunkenness, binge drinking, and problematic consumption.
Cercanía importante, por ejemplo, para el caso del consumo problemático de alcohol.
As you can see,
el 46.2%
of problematic use of alcohol in women, and in the case of the adolescents, 40%.
Por supuesto que es una advertencia para todos, todas, ciertamente porque, como ya se expuso,
here we see that women have a vulnerability condition that is special. In addition to metabolic issues and the issues of increasing sexual victimization and higher risk of alcohol.
Aunque existe evidencia mixta respecto, el efecto telescopio.
Related diseases, we have the telescopic effect. Of course, these figures, how can we interpret these figures that can look into more depth in this data? It is clear that women, as opposed to other generations, have a greater exposure to alcohol. Actually, in the study, we asked if in the last 12 months, she was promoted by adults to go and purchase alcoholic beverages. And approximately 68% of those school-age children answered yes. And an adult asked them to go and buy alcoholic beverages. And these differences between men and women did not exist. Similar percentages of them reported the same experience. And the traditional models of masculinity and gender models have changed. And certainly, the advertisement for alcohol has taken advantage of this change to get more and more users. In that same study, we identify some risk factors. Among the most important ones, those related to the context, the perception of how easiness of access, the offering of marijuana, this is for the legal drug consumption, and also we identify as risk factors the low family integration, the low perception of risk, the presence of drugs inside school, the lack of preventive actions, and a low protection of the school environment. And finally, the community was also a risk factor if those communities had a high vulnerability. Example, the presence of micro cell commerce of drugs. So both at the community, family, contextual, and individual level in the school environment, we have risk factors, and the preventive response has to be sent this multidimensionality of risk. And the picture before the pandemic in terms of trends showed us a reduction In terms of legal drugs, we see that the prevalence up to 2017 were up to 20.3%, and we saw an increase of illegal drugs, mostly by the increase in the use of marijuana. And there was a maintenance with respect to 2012 with a slight increase in the use of other drugs. But after 2017, what happened? What is the magnitude of drug use during this time? Well, certainly, what has been progressively being published globally, in the case of the adolescent population, we see peace. But careful, in the case of systematic reviews, we have that in the case of adolescents who already had risk behaviors, that use increased and got worse during the pandemic. And here we will have to add all the conditions of mental health that have already been recorded. Makes us assume that at present we have a vulnerability scenario that makes that we need to strengthen our preventive response. Last year, we recorded the use of substances in the population in our preventive programs in DC, considering all the population that was studied from first to fifth year of high school. We saw an annual prevalence of legal drugs of 9.6%. When we break it down a year of high school, we see that the highest prevalence are those in fourth or fifth year. Now, although this figure, it is true that these figures could indicate that, and these are not comparable populations, I must clarify, this is the high school, public school population, and this is a population that corresponds to the population following the preventive problems. So it is important to make this clarification, but we still see an important decrease in Peruvian case, for example, both in 2020 as well as 2021, we have had a closure of schools. And the mobility of children and adolescents in Peru was quite restricted. It is only this year that schools reopened. So any information record should be understood as a reference, and hopefully later we will able to do measurements at the population level and be able to record what has been the real impact of all these stressors or this stress environment that was generated by the pandemic. We have, since 2020, a national policy against drugs towards 2030. We can see that one of the priority guidelines is to prevent drug use, with special attention to the school-age population. Recognize that prevention at the school level is a priority environment, and therefore we need to provide full support. We have the budget program for prevention and treatment of drug consumption, known as PTCD. This budget program starts operating in 2012. And certainly, it has included a reform to our actions in a previous period. that this period was characterized by the implementation of focus projects. The preventive intervention was mostly in Lima City. The budgets were quite unstable, and it was mostly based on international cooperation. So there was an implementation of preventive program scenario, the level of the state government, which depended from external aid. It is 2012 where the government state started to invest in a sustainable way in preventing drug consumption. And with this moment, we started to deploy a series of mechanisms that had no previous history. For example, the implementation of large-scale preventive programs. Annually, thousands of students from public schools of high school level benefit from preventive. This is a major responsibility, of course. On the other hand, there is a progressive institutionalization at different levels. One at the preventive practice, reduction in the school environment is applied as tutorships. There is a curricular implementation. This also differs from previous periods where prevention was extracurricular. So prevention is inserted in the education process, understood as part of that process. But we also have the financial institutionalization through this budget program year after year. The Ministry of Finance allocates resources to the regions for the implementation of this program through the regional education office. As I mentioned, this is relevant reform. On the other hand, it also implies an improvement in protocolization. We have manuals, guidelines, and that also allowed us to have more structured programs and be able to measure outcome. On the other hand, there's been a dynamization of multi-sectorial and multi-level governmental relation by using educational sector, health sector, under the coordination of VIDA, and also at a community level. So the P and management is articulated in the three levels of government and others. But I think that this is also important, as previous presentations have talked about the evidence, the design of the budget programs, best fact of having evidence for action. Evidence for action. It was also a large, major challenge during the design of this budget program, talking about the year 2010, 2011, long time ago. Before the logical of intervention was mainly directed to generate and develop interventions, but there was no link outcome. And in the process of formulation these budgetary programs, you need to be very clear on what are the so-called performance indicators that evidence results in the population. All the inputs, all the services that are required can have an outcome in And that we've taken it very seriously. And every year it's an opportunity to improve our intervention, always looking at the scientific. Just some general data that may show what progress we've made in recent years. Considering 2015 to 2021, we see in the case of 2015, more than 438,000 school children benefit from these prevention programs. We cannot always have the budgets of this magnitude. Sometimes conditions coverage, but even during the pandemic, we have benefited a large number of schoolers. That commitment is going to be strengthened with coming years with the multi-sectorial planning that we carry out. And of course, in the case of 2020, 2021, and this current year, there's been a significant challenge. Before the pandemic, we had preventive intervention models, quite detailed. For example, these preventive programs that are carried out with school had 12 sessions. Intervention worked with 5 programs in parallel. There was a program for first year of high school, second, third, fourth, and fifth high school year, with specific topics, and all of them, of course, with guidelines and manuals. For 2020 and 2021, we had to adapt, which implied, of course, to make some significant modifications, but without losing the orientation that these problems have, which is to strengthen psychosocial skills. It is clear for us that this large number of students not only has to be informed about the negative consequence of the use of substances, but also acquire those skills. Because we understand that that's how consumption occurs, go from an information optic to a training format perspective. In this case, during the pandemic, we maintained that spirit of strengthening psychosocial skills. And what we did was adaptation through digital tools, where through infographies, instructional charts, and audios, the teachers work with the students, and the same with the families, where we look to increase and strengthen parental skills. In this last case, without losing the integrity of the program, in the year 28, with the budgetary problem in 2012, we have bet for this program strengthening. This program is evidence-based, and we also had a challenge to do the implementation without losing the integrity. This adaptation effort in the universal prevention made that go from 12 sessions to 6 sessions, having 2 working areas. The first, according to the classification from the Minedu, is the 6th and 7th cycle. In the 6th, we're talking about first and second high school year, and the seventh cycle with third, fourth, and fifth high school year. Each one has its own topics. If we will transform this in intervention variable, a student study habits, risk perception, we have resistance social skills, we have emotional control. These are the charts that we've been using during the implementation. Here there was a major effort. Prior training, they had to deploy different strategies to maintain the motivation of the school children. Session guidelines to work with these charts with a very clear structure, with a presentation, development. Here we develop several outputs, working posters with plenary discussions, and depending on the topic, some look skill. In the case of selective prevention, we had 7 interventions with 7 sessions. Here we work social educational workshops with 10 to 20 participants. These kids are at a risk situation. They receive this intervention, but also in an related effort with the family. And behind this, we had many creativity work with. They had to set up WhatsApp groups and use in a creative manner Zoom, other platforms for implementation of these programs. And the big, it worked or generated any effect interventions? This is also a reform brought by the budgetary program. And the fact that we can see how far we've reached with intervention, although it's true that these figures can be extremely positive. The major question here is, from this total, how many really benefited with developing skills in terms of prevention? In the evaluation that was carried out the past year, that considering the total of interventions from first to fifth year of high school, more than 70% an increase in this skill. We see that the first 2 grades,
los porcentajes más altos.
The highest percentage. And all these efforts carried out through this budget program for prevention and treatment tries to be aligned with evidence and the efforts that are done at the regional level. Countries of our region are also doing having efforts to tailor their interventions to scientific evidence. There is a progressive adoption of the evidence. Undoubtedly, the international standard in the prevention of use of drugs is reference. There are countries that are working at the level of control trials to establish the efficacy of interventions. In the Peruvian case, we have an experience through the Cayetano Heredia University. where we have a Peruvian adaptation. And these figures can make us happy. It is clear for us that there are several challenges. First one of expansion of preventive coverage of our programs. We currently reach 16% of the institutions, so there's a gap that's quite significant. Covered. The idea is that more students can have access to programs, but good quality programs, and that is going to imply an continuous improvement of the content. That is, each session can in fact develop competence. A significant challenge because it also considers the fact of having a closer and intensive technical assistance would be those teachers who implement this. And in that improvement of content, we already mentioned the gender issue. It's important that the content is sensitive to gender, considering the information that I presented at the beginning of my intervention. And also, in this complicated situation of the pandemic, in those skills and competences, we can work behavioral skills, emotional self-regulation. On the other hand, also consider the earlier preventive intervention. The starting age of consumption is very early. So we could implement programs not necessarily with a specific track curriculum in elementary or education, but to contribute to the limitation and contention of some of the early risk factors. To have an evolutive phase of this condition is going to potentiate our response. On the other hand, we also consider focus our efforts in the evaluation of fidelity and adaptation. This issue of fidelity, which is a degree to which the implementator complies with the protocols of the intervention, is of utmost importance. In fact, fidelity or lack of fidelity in the implementation of school-based preventive programs is a factor of inefficacy or a factor that doesn't contribute to the obtain of results or outcomes. So there we have an important challenge. On the other hand, we also have to consider the adaptation process, that instead of seeing them as a risk, we can see them as an opportunity for the teacher without losing, of course, the core content of the session, to be able to adapt that generates greater closeness in the region. Peru has a large diversity, and there's a need for these preventive programs to adjust to that diversity. And here is where the teachers have an important space to deploy adaptation actions without losing the core elements of the program. And with the pandemic and what we have been developing in these last 2 years, to maintain and increase the virtual channels, both as technical assistance teachers, but also deploying virtual tools for the students. So there are complementary spaces for the on-site effort started this year. And finally, and this is something more of public policy or public management. So it is true that we're going to improve the preventive content. We want to comply with quality standards. We know that the programs by themselves are not going to generate significant changes if we don't articulate them with different services and spaces in the preventive areas. So in parallel, we need to have a progressive improvement of the impact of preventive programs, but also starting to articulate other spaces within that same territory. We can have community, family, school, and of course, all the institutional effort with the programs and being able to increase the impact of the intervention. That is to look at a level of preventive system, not only consider the programs, but also create preventive system. That's it. Thank you very much for your attention. We are grateful for the intervention of the specialist William Cabanilla, who spoke about the Peruvian experience in preventing the use of alcohol and substances in the educational environment. A national study on prevention and consumption of drugs in high school students in 2017 reported that 33% of the population, school-age population, smoke and consume alcohol. Between 2007 and 2017, there was a decrease of alcohol consumption in the school-age population. However, the patterns have changed. At present, women consume more alcohol. Factors involved in a higher consumption of drugs are several and are present in several contexts, at school, family, community, and therefore the approach should be comprehensive. He presented some data with the intervention population, especially of the high school population, where 20% of students from 4th and 5th grade consume alcohol and tobacco. Mention about the progress made in the national policy against drugs to 2030, where you effectively use the scientific evidence and the use of budget and better protocol interventions and actions and focus on prevention. Pandemic, of course, represented a challenge for the continuity of the interventions. Therefore, they had to adapt and prioritize those actions directed to the risk groups. Among the successful strategies, we have the program of strong families, Amor and Limit, a topic in which mentioned in a different webinar, and I would invite you to review the video. We will be sharing the link in the comment box. And finally, he shared the challenges where we find the increase in coverage of activity in the educational environment with a constant improvement in the content focus on preventives that are gender sensitive and cultural sensitive, and to maintain the virtual channels. Thank you once again, William Cabanilla, for your presentation. At this moment of learning and knowledge exchange, it is essential to take some time to relax and start a mini physical exercise session while teleworking. Horas Conju encourages the wellness of those who join us in this virtual session. And in this next minute, we will exercise with an active pause. Start the active pause.
Querida Yadi, ¿no se escucha?
Pañito Unanue, queremos agradecer por este espacio saludable para venir a hacer una pausa activa y desde el Horas Conus darnos un tiempo
Going to have this active pause. We have a visual pause. Take care of our eyes. We only need is a pencil, a small object, and a wet towel. It's going to be very useful. We thank everyone from the different countries who join us that are learning how to take care of their eyes. So let's start strengthening the ocular muscles. This is important. So put your pen and start doing this.
Movimiento de derecha a izquierda, solo con los ojos haces el trayecto del esfero, no vas a girar tu cabeza. Entonces vas a empezar a mover tus ojitos de derecha a izquierda, un movimiento lento pero amplio. Solo tus ojos siguen la mirada y descansas. Vas a parpadear exagerados 5 veces. El parpadear nos ayuda a lubricar, a hacer que nuestros ojos se hidraten muy bien. Ahora con el esfero vas a ir arriba, abajo, arriba, abajo. Recuerda que solo sigues la mirada con el trayecto, no giramos ni movemos la cabeza. Muy bien, ahora vas a juntar, vas a hacer arriba, abajo, derecha e izquierda, como una cruz. Arriba, abajo, derecha, izquierda. Arriba, abajo, derecha, izquierda. Parpadea, parpadea, 5 vecesitas. Y ahora dibujamos un círculo. Muy bien, círculo amplio, lento, no tan rápido. Y hago el movimiento con los ojos. Eso es, no tan rápido, pero sí guiamos el movimiento hacia un lado y luego devolvemos. Eso es, perfecto, intenta hacerlo y vas a ver cómo tus ojos se sienten un poco agotados. ¿Por qué? Porque es como si fueras al gimnasio. Esta es la pesa para tus ojos. Siguiente ejercicio, brazo derecho extendido y con el dedo índice también un poco cerca a tu rostro vas a empezar a mirar. Primero el esfero, luego el dedo índice. El esfero, dedo índice. Cosa que vamos a aprender a que nuestros ojos hagan un enfoque y desenfoque de un objeto cercano a un objeto lejano. Por eso es muy importante que el esfero esté más lejos y el dedo índice más cerca. También lo podemos hacer mirando, no sé, un cuadro a la ventana. Entonces miro ese objeto lejano, miro el esfero. Miro ese objeto lejano y miro el esfero. Y hacer esto varias veces al día ayuda a fortalecer nuestros ojos. Luego de que hagas estos ejercicios también es importante la relajación. Para eso necesitamos ese pañito húmedo que nos va a ayudar a bajar un poquito la tensión de nuestros ojos. Vas a descansar cerrando los ojos, no los vas a abrir. Vas a tomar tu pañito húmedo y lo vas a colocar sobre tus ojitos. Eso. Puedes colocar música suave y respirar profundo. Inhalo, exhalo y empiezo a hacer un pequeño masajito con la yema de los dedos sobre los párpados. Un pequeño masaje sobre las cejas. Vas a hacer como si las limpiases desde el entrecejo hacia afuera sin abrir los ojos. Vas a limpiar por debajo de los ojitos hacia las ojeras, muy suave, nunca abres los ojos. La idea es que baje la tensión que pueda haber. Puedes presionar solo para que se irradie esa frescura que puede tener el pañito húmedo. Lo puedes colocar en la frente. Inhalas profundo, exhalas. Un poquito de masaje con dedo índice y corazón al lado de tus ojitos para la relajación, siempre con respiración profunda, y el solo hecho de cerrar tus ojitos hace que descanses. Parpadea 5 veces y descansas. Esto lo puedes hacer un periodo más más largo, pero vas a ver cómo tus ojos descansan. Por eso desde el Horas Como agradecemos a todos por habernos acompañado en esta pausa visual. Espero haya sido de su agrado. Muchísimas gracias. Chao, chao.
Muchas gracias por la pausa activa. Para iniciar este diálogo a partir de las preguntas.
Thank you much for this active pause. We will continue with our dialogue. You please activate your videos. During this webinar, our participants have left some questions. We will try to answer most of them.
No puedo poner mi cámara.
Okay, no hay ningún problema. Estimado William, ¿se podría
William,
encender?
could you please activate your video?
La primera pregunta va
The
hacia
first
la
question
doctora
is for Dr.
¿Se han
Angie.
explorado los motivos por los cuales
Have you
mujeres
explored the
tienen
reasons why women
a un menor tratamiento
have
por
access to
consumo de
less treatment for drug use disorder? Thank you very much for the question. In this year, we've also have an informal network of scientists, and we have discussed this. And the truth, there are many factors or barriers for women. The stigmatization in women works different than in men. And there's also, we need to mention that in general, there are less women who use drugs, and that we've heard from Mr. William from Peru, that this telescoping effect that women use less, but when they consume, they develop some more complex and quicker dependency with more comorbidity than men. But talking about barriers, stigma is one always present, and sometimes there's a limitation in economic resources because many world countries you have to pay for these treatment services. And something else that we are lacking is that there's no care for children, and many times there's a fear of the legal consequences as identified as a woman who's seeking treatment is afraid that the state is going to take control of their children. These are one of the factors. There are many others, but these are some of them. Thank you very much. We have another question for you. What age sector, age group has higher level of drug consumption? Age. What age group? Yeah, what age group? Well, it depends on the substance, but in general, these are adolescents or young adults where there is a higher prevalence. That doesn't necessarily imply drug use disorders, but the use, the consumption for example, cannabis is in adolescents and young adults that have the highest prevalence. And following, and this has to do with economic inequality, is that we know that these are young who have limited resources or more poverty. They have a higher risk of developing dependency. And those who come with families with more resources, they have more, the risk factors are lower, so they're going to have less chance of developing drug use disorders. That too. Thank you for your response. The next question for Dr. Maristela. What are the most effective interventions to reduce alcohol consumption in adolescents? And the second question is, the increase of alcohol consumption is it associated with an increase of depression and other mental health disorders? Thank you. In adolescents, we have many factors to initiate and continue with this consumption from the family factors, environmental factors, peer pressure, and in the case of alcohol, the exposure to marketing, alcohol marketing for promotion, sponsorship, sports is financed by this industry with a marketing that promotes the initiation, the desire of consuming alcohol when they speak for over the age of 18. But we know that this doesn't work and that children participate in this same program that their parents see or go together with their parents. So the marketing exposure is the same for both. At the parental level, the lack of supervision of their children, the lack of clear rules of avoiding the use of alcohol, of parties with alcohol, where the law bans the consumption, the parents are offering and organizing, or the other family members organize parties for when she becomes or he becomes 15 years old with alcohol consumption. And that introduces this young person to an early consumption. The peer pressure or the peer influence, where there's no control of access to alcohol, this facilitates them to share their beverages and to buy at a very low. So the taxation measure is very effective for young because in their pockets they have no much money. So it responds to measures that decrease the availability and access to alcohol products. Now, in terms of the pandemic and alcohol consumption, the mental health issues were a contributing factor in increasing the consumption. Stress, anxiety, these two main conditions also favor the use of alcohol to deal with the negative symptoms or emotional negative symptoms of these conditions. Mostly for adults. And I don't know if there are surveys that look at adolescents only. We know, from the informal point of view, we know that it does. But there are situations that promote this kind of behaviors. Thank you for your answers. And the following questions are for the specialist William Cabanillas. You consider the educational strategy of peers in the national policy. And the second question has to do with what we're looking at football. What is the influence of advertisement of alcohol in sporting events, especially football or soccer?
No le escuchamos.
Perdón, ahora sí, ¿se me escucha?
Can you hear me? Yes.
Muy bien, bueno.
Well, been commented about the adequacy of use of peer strategies in some experiences in evidence-based programs. They have worked. And in fact, I believe that under several guidelines, the use of peer strategies may work adequately, especially through modeling. Modeling or example under the perspective of adolescents that can have leadership activities, promotional activities, self-determined preventive activities. I think it may work very well. In fact, several projects carried out in our country have used the youth leadership as a strategy for prevention at the level of sport promotion or artistic interventions, but the fact is to generate an idea that preventive program empowers me, and I exercise my leadership and organize a positive project. Although it is true that I made emphasis in scientific areas of prevention, looking towards the condition, I think that each preventive program generates leadership, and that is key. One thing that you should deploy preventive programs. We look at the intervention manual and see the fidelity of the intervention and take care of the adaptation. But what is the message or the idea? If we like to rescue the issue of identity in the history of prevention in Peru, there have been some experiences, not perhaps with the scientific approach, but that have generated some identity in student community. In addition to look at scientific guidelines, it is very important also that the preventive programs can generate identity either locally or youth leadership of empowerment. Now, in terms of the link, advertisement and sport, well, certainly it is clear. This is part of the strategy by the beer company to accentuate the condition of normalization of alcoholic beverages. So there we have a pending issue. Our country has not applied the international agreements in a strict fashion. There we have an area of work that we need to work more. We should, for example, ban the sponsorship as well as advertisement in sporting scenarios, and of course in others, together with the progress that we've made in the effort. Thank you for your reply. Thanks for the questions. We were not able to respond all of them, but we will consider them to define the webinars and the next webinars. We appreciate your participation. To close this space of Q&A, I ask the speakers to leave us a message or final comment of 1 minute in the order of lecture, Dr. Anja, Dr. Maristela, and Dr. William. Well, what I'm thinking about the topic, because it's the International Day of Drugs for June 26. We have these two challenges. As a health crisis, like COVID, but there, on the other hand, thinking in a wider humanitarian context and not leave anyone behind, I think it would be very important to somehow improve the data that we have, because we have seen the COVID reality still present. We are 1 or 2 years behind the start of the pandemic. This is something that we need to consider, and other evidence-based interventions in prevention and treatment that have worked before COVID. We have those international standards for prevention in the use of drugs. We have international standards
Trastornos por el uso de drogas, desarrollado estos dos documentos juntos con la OMS y
for the treatment.
Que están
together
disponibles.
with the UNODC. It is available in Spanish, and I'm thinking that COVID more
español como en inglés, casi como un crystal ball, ¿no? Alguna cristalización de como problemas ya
than anything was
antes de alguna manera
like
como estas
considering how these inequalities that exist in the marginalization of people who use drugs. So we have the responsibility altogether, the Andean country, the international community, to improve the access to prevention and treatment that is based on evidence. I think that's it. Thank you very much for the invitation and happy anniversary to Horas Conju.
Adelante, doctora Marisela.
We will also wish a happy anniversary to your organization. My message is about the situation that we are at present on recovering after the pandemic and to prevent the next wave or effects of a next pandemic. In terms of alcohol, the policy went backwards. The increase of sales discount of businesses and lowering the taxation to favor consumption without taking into consideration the harm. And the consumer and the governments pay much more than what they receive in this profit by alcohol sale. For the taxation, it is important to use this mechanism. This is a legal instrument that governments have to generate resources and to improve health. Both can be done simultaneously with alcohol, tobacco taxation, and soft drinks. And the other issue is that in order to prevent problems, we have to create and maintain services. We need to widen access and access to services close to where people live, and also align how this has worked in many countries, and we need to continue expanding this to improve the health provision to everyone who needs them. Thank you.
Adelante, doctor William.
Go ahead, Dr. William.
No le escuchamos.
The pandemic has left us a negative impact in our country. It's publicly known high mortality in our country and the economic, social impact. But this pandemic scenario brought the issue of mental health and addictions high in the agenda. Perhaps those who have followed this topic for many years, as never before, mental health and care has been in the media, in the reflections. So this is an opportunity for those of us who has part of the responsibility in this chain of solutions to reinforce our commitment, improve our practices. I would just like to leave two sentences: more quality prevention for everyone and evidence for action. Thank you.
Muchas gracias. Ha sido un gusto
Thank you.
moderar este
It's been a
webinar.
pleasure to moderate this
Agradecemos
webinar
a los
and reiterate our gratitude to the excellent speakers today and to all the attendees who accompany us week after week, to the Horas Conju team, and to all those who participate in this activity, which has been possible thanks to the commitment to Andean and Latin American integration. I give the floor to Dr. María Carmen Calle to close this webinar. Go ahead, Dr. Calle. Well, my first words are of gratitude, special gratitude to our excellent speakers. They have allowed us to talk about the topic from different optics. We've spoken about prevention, diagnosis, treatment. We've spoken about updating tools, use networks to improve the topic. And we have made an important comment in terms of prevention. It has been wonderful to have representatives from the United Nations, from the Pan American Health Organization, the WHO and the Vida. And I mention this not only from the institutional point of view, but from a very personal perspective. For many years ago, I trained the Vida professionals in the program of Strong Families, Love and Limits, or Boundaries. And this was many years ago. And I've been how this program has been adapted to the Peruvian reality and has been adapted to the coast, to the highlands and jungle, and also has been adapted to the virtual reality. So this program was born at the Iowa University and was adapted by the Pan American Health Organization, and from there it went to several countries. I believe in prevention. Definitely believe in prevention, but I also believe in treatment of the person who suffers this condition. I think that it is very important what you have mentioned, and it can be useful for almost the 400 participants that we have from our countries. I'm talking about Bolivia, Colombia, Chile, Ecuador, Peru, and Venezuela. But I'm also talking about Uruguay, Guatemala, Japan, Mexico, Cuba, Angola, Solomon Islands, and Argentina. That is why we are also, for the last 4 weeks, we are putting all our webinars with interpretation into English. We have also requested us interpretation to Portuguese, but let's go step by step. So the drug issue is very important, and we have discussed about adolescents and young persons. And the number that I mentioned that was asked in this famous 275 million, who represent 5.5% of the entire population that has consumed, tells us that this is a public health problem and that we should do every effort possible to prevent, diagnose, and treat. In a special manner, we also talk about women's issue, but in general, women, girls, children, adolescents are always the ones who present higher vulnerability. You also mentioned that this pandemic has been catastrophic, but not only catastrophic from the health point of view, but also economic, social, and mental health has been extremely affected, and now we are seeing many of those consequences. In other words, we know that this topic is very important, and all of us who are in primary care have the obligation to contribute to a complete care. Once again, thank you so much to our excellent speakers, and we invite you for next Thursday. We have our webinar number 128, that will be childhood malnutrition and food security, a topic that's very strong at this moment. I would like to thank Lee, Milagritos, Yadira, Rob, and all the members of the Andean Health Organization who make possible that we continue in this continuous learning to have evidence-based information in order to make better decisions. Because in addition to what I've said, we should not forget the policies, public policies, the legal framework that together to what has been mentioned, they definitely will contribute to improve this problem, to decrease the problem. Thank you very much. See you next week.
Muchas gracias.